cases are picked prior to the surgery. You need the right instruments, you need the right supplies, different kinds of bedding. If it's an orthopedic surgery, patients are put in different positions, props for the patient, any kind of bed padding that's needed for any case that's being done. The cases are picked, such as all the instruments that you need for that day, and all the supplies needed. Supplies such as your bandaging that you're going to need, extra laps, which are what's considered like sponges. You got towels, you have suture or stuff that you're going to need to close the wound that you are opening up. There are papers that we look through to go by these cases, and all cases are different. All surgeons are different, so different surgeons use different supplies. Most of the instruments are the same. They might use a few different things different, but it's technically like if you're taking out somebody's gallbladder, you would use the same instrument cases. It's a general case that has the basic instruments needed for a general case. If it's an orthopedic case, you get your orthopedic cases, depending on whether it's a knee or a hip or an arm or even a foot. Fixing broken bones is completely different. So depending on the cases, depending on what you get ready for the case. These are all taken in the room and opened up and laid out. The tables are put together, and all the instruments are laid out by the surgical technologist. That's the main thing that you do before the patient even comes into the room. During surgery, one of the most important things is to keep an eye on the patient's vitals. Surgeries can last up to 10 minutes, up to 5 hours or more. The patient is positioned on the bed with the correct paddings and everything to ensure that none of the blood supply is cut off to a limb, or that the nerves aren't being cut off due to their arms being in the wrong position, laying on their elbow where their nerve can be cut off, and that can lead to nerve damage in their fingers or their arms or their legs. That is one thing that the nurse has to make sure that is properly done all during the surgery if the patient has to be moved for any specific reason. The nurse is to maintain complete vitals of the patient and keep them monitored along with the anesthesiologist. The surgical tech part in it, of course, is to make sure that the surgeon has everything that they need, passing the correct instruments, making sure that the area is cleaned from any excess blood, moving away instruments that the surgeon is no longer using, making sure that, like I said, the surgeon has exactly what they need when they need it. The closing of the case is, of course, making sure that the surgeon has the correct sutures for the case, and of course that everything is working the way it's supposed to. Doing x-rays if needed, or making sure that all the instruments have been, and all the laps and any kind of cotton that has been used or anything used, that it is no longer inside of the patient. That is making sure that that's taken out before suturing the patient. After surgery, the nurse is making sure that all the vitals are put into the computer, taken with the anesthesiologist and the surgeon over to PACU, and letting PACU know what was going on during the case, if anything had happened with the vitals, whether they dropped or they went up, heart rate, etc., what kind of medicine that they were on during and after, letting PACU know what needs to be done with their vitals, that they are hooked up on the monitors to monitor them during it being in PACU when they wake up, and it can be a long process in there. The nurse is relieved of her duties in the PACU. She signs off on all her paperwork, and the patient is no longer in her care. They are in PACU's care. She then goes back into the OR room, and where the surgical technologist has been the whole time, where they're cleaning and making sure that the room is set up for either the next case or the next day. They clean with a specific kind of cleaner that kills germs as soon as it dries. Everything is wiped down from the bottom of the bed, the tops of the beds, the tops of the tables, the light fixtures that were used. Anesthesiologists have their own team that comes in to clean their area and get it stocked and get it ready for the next patient. And then it all starts over again.